Hello guys, welcome back. So this video is the continuation of Nurses Specialties Part 1. So if you've not seen the first one, I suggest you watch that first before coming over to this. So let's continue. Now let's go back to geriatric nurses. They deal with elderly people or elderly sick people. So sometimes it can just be elderly people because with age people tend to fall sick, and then even if there's no actual disease happening or disturbing that patient, just because the person is really aged, the person might need help, the person might need care, the person might need treatment. And elderly patients that have issues with mobility, that have issues in doing certain things for themselves, a geriatric nurse is there to assist and is there to help. So you mostly see them in all these elderly people homes or aged homes. Yeah, that's where they mostly work. Though they can still work in the hospital, especially hospitals that have a facility or have a center for elderly people. Yeah, that is what they do. Nurse researchers are people that work in labs. They can work in schools like universities, just to make research on how to improve the quality of care given to patients, and also they can analyze different treatments procedures. Yeah, just making research into medical care, making research into medical treatment, making research into medical procedures, so that in case they find anything that is of use or is better for the hospital, is better for nurses to implement, they go ahead and implement it and make it a law, and nurses start implementing it, and nurses around the country start implementing. That is what basically nurse researchers they do. So yeah, let's go over to legal nurse consultant. So legal nurse consultant, these are nurses first of all, and then they are lawyers also. So basically they work in the courts whenever there is a medical case. Like, let's say for example, a patient is suing the hospital for something, and that kind of cases, that they are mostly handled by this legal nurse consultant. And it might not only be that, it can also be any hospital related crisis, any hospital related lawsuit, or any patient related lawsuits, anything of those sorts. This is what a legal nurse consultant they do. So it's something that is also lucrative in a way. It is in a way, compared to, if you are comparing it with most of the specialties, it's also something that is lucrative. So yeah, if you are someone that also like law, and then you happen to be a nurse, you can decide to go over to the legal aspect of nursing and become a legal nurse consultant. That is what it involves. Let's talk about forensic nurses. So forensic nurses are nurses that link healthcare and justice. This is different from the legal nurse consultant, because what they particularly do, forensic nurses, what they particularly do is that they treat people that are victims of crimes. So let me paint a picture. Let's say, for example, there's a rape victim, and then this rape victim needs to be attended to. Normally how it's supposed to be is that it's a forensic nurse that is supposed to attend to the patient, but then sometimes it can be a general nurse. So it's a forensic nurse that's supposed to attend to the patient, and then as the person is attending to the patient, the person is taking evidence. It could be swabs, it could be photograph, as far as the patient is comfortable with it, and some other things, just to make sure that the patient gets justice. So this evidence is being submitted to the courts, and the whole process is being followed up with us to make sure that this particular patient gets justice for whatever crime might have been committed. Like I said, it could be an incident of rape, it could be abuse, physical abuse, and sometimes it could be death investigations. So a forensic nurse can also do an autopsy, just to find out and get evidence to know if this person was killed, and if the person was killed by who. Now the next one I'll talk about is psychiatric nurses. I don't know, I've talked about it earlier. We already know what psychiatric nurses they do. They work with people that are mentally ill. It can also be called psychiatric or mental health nurses. So they work with people, like I said, that are mentally ill and just need treatment and to give them medications to make sure they are not inflicting harm on themselves, and just take certain precautions to avoid a mentally ill patient from harming themselves or harming people that are around them, or over harming the nurses or any health worker. Let's go over to nurse educators. Nurse educators are basically lecturers, people that are nurses, and then they are educating the junior generation on becoming nurses, on how to become nurses or becoming a nurse. So a nurse educator or someone that teaches nursing, it can be different area of nursing. It might not be your teaching nursing, but they are employed in universities majorly to teach in nursing department or in a nursing school, just to teach the junior generation on different courses that helps them in their process of nursing. That's basically what a nurse educator does. So yeah, it could also be a particular area in nursing where you can decide to venture into. If you don't want to work in bedside nursing, you can also become a lecturer, you can also become a nurse educator. Yeah. Next we are talking about is occupational health nurses. So these nurses are people that work in a workplace environment. What I mean by workplace environment, in an active environment. It could be a construction site, it could be a site like where they are active workers. The aim of these nurses is that they try to prevent injuries from happening. They educate the employers on how to be safe in this kind of rigs or in this kind of sites where there can be chemicals, where there can be incidents of fire explosion. So they're just trying to educate the patients on, sorry, the workers or the employees on how to avoid incidents of fire outbreak, on how to avoid injuries, and also they treat injuries. So any minor injury that might happen in the site, the nurses will attend to those patients and just stabilize the condition. And if it's a case where it becomes severe or it becomes critical, the patient is referred to an actual hospital where he or she will be receiving the treatment he requires. So any minor thing that might happen on the site, it might not be as a result of any injury. It can just be a health condition that one of the one of the employees might have. So the nurse can attend to them and just stabilize them for the period where he will be working on that site, or where she or she will be working on that site or that construction area. Next one is midwives or nurse midwives. Same thing. So we already know who a midwife is. They are nurses that assist women in the process of pregnancy, the process of labor, the process of delivery, and also they help in postpartum care, that is after delivery care. So that is just the summary of what a midwife does. They help the woman to monitor her health during this process and till she gives birth to her child, and also how she can take care of her child and herself after pregnancy and after delivery. That's what they do. And also there are some other minor things that a midwife can do, like circumcision and some other things. Let's talk about renal nurses, renal or dialysis nurses. So these people are people that handle patients that have kidney issues, that have kidney problems. So patients that are coming to the hospital for dialysis, is a dialysis nurse or a renal nurse that attends to them and takes care of them and just treat them, give them their medication, and monitor them while they are on dialysis. Monitor them while they are on dialysis and after their dialysis. Sometimes it might not be a case where they have to be admitted in the hospital. So whatever the case might be, a dialysis nurse or a renal nurse attends to patients that have kidney issues and just treats them and manages them throughout the whole process, and gives them general health information or general health education on their kidney and how they can be managing their kidney issues. Last but not the least, let's talk about cosmetic or aesthetic nurses. So these are nurses that takes care of patients that have undergone any cosmetic surgery or any cosmetic procedure. It might be stuff like BBL, it might be stuff like hair transplant, it can be stuff like Botox, BOTOX, um, fillers, and just patients that does most of all these plastic procedures. So these are the nurses that take care of them and treat them and just manages their um, recovery while they are in the surgery and while they are out of surgery and while they are discharged to go home. So that is basically what they do. Is something that if you're interested in, you can also make a research on it and find out the schools that accommodates these specialties, and just know the particular area that you would like to specialize in and go into it. So guys, that is basically, if we have come to the end of this video. I know it was kind of just a little bit long. I hope you got one or two out of it. Feel free to share this video to anybody that you think might need it, and yeah, if you have any information, yeah, let me know which specialty do you think pays the highest. Is it travel nurses, flight nurses, or nurse anesthetic, or whatever nurse specialty you think pays the highest? Let me know in the comment section, and yeah, I'll see you guys in my next video. I hope you enjoyed this, by the way. Bye.